have been falling since early April. They hit a new low this past weekend with just 198 cases reported on Sunday. CNBC.com technology and health reporter Chrissy Farr joins us now to talk about some of the things that have set Canada apart from the United States and perhaps some lessons that could be learned. Chrissy, a very good afternoon to you. Thanks for joining us. What's the sort of headline takeaway on Canada in terms of how bad it got initially and where they are now relative to that? Was it a national crisis or a regional crisis for them?
Yeah, absolutely. Canada has had a very different response from the US, its neighbor. Really, 90% of the cases focused on just a few provinces, and that was Ontario and Quebec. They had an amazing COVID-19 response in British Columbia, and it really could have gone very badly there, given that some of the first cases were there. But they had such a strong public health leadership, very consistent messaging from Dr. Bonnie Henry, who's now become a bit of a cult hero in Canada. People just love her. She's very empathetic, has been, encouraging people to follow the public health guidelines, visibly sometimes emotional when she talks about COVID-19 and is always reminding Canadians to be kind to each other, to support each other through the crisis. So it's just an extremely different kind of leadership that we're seeing from Canada. And they've definitely had results that are very different from ours, far fewer deaths and just far fewer COVID-19 cases overall.
Did the national aspect to some of their spending make a difference, whether that was actually on the healthcare side or on the economic side in terms of preventing unemployment, perhaps leading to as big a pullback in the economy?
Absolutely. And they have been praised for their economic relief packages. It hasn't been entirely perfect. There have been delays, just like in the US, with receiving any kind of assistance. But overall, it's been a fairly robust program in terms of the economic side. And then they do have more of a healthcare system than we do. It's still kind of a combination of public and private. And from that front, I just heard consistently through this reporting that they've just really seen a lot of very kind of brave providers. There were initially some concerns about protective equipment, but now that seems to have been solved. They've really gotten their domestic engine running when it comes to manufacturing. So they've done a very good job there as well. The one big failure, though, has been the long-term care facilities. And that is a system that people have been saying for years needs more funding, needs more staffing. And some of the worst outbreaks happen there and really hit their vulnerable elderly population. So I think that's something that Canada will have to look at in the long run.
Chrissy Farr, thanks.